This is a continuation of answers to some of the student questions that were submitted during Module 1. This particular group of answers will respond to questions related to community health assessment itself. As you can see, we consolidated the questions, and there were 10 to 12 different themes that the questions addressed, and I will go through each one of these one by one. First question, are community health assessments required? Periodic community health assessments are in fact mandated either by regulations or statutes in several states, and those states include Florida, Illinois, Missouri, New York, and North Carolina, although other states are included as well. As you know from the STOTO presentation or the STOTO reading and some of the lecture material from Module 1, the Affordable Care Act also requires community health needs assessments to be done by nonprofit hospitals, of which there are about 3,000 in the United States. In terms of who's doing them, there's some data here which is from the 2010 NACCHO National Profile of Local Health Departments. They surveyed the health departments. They have a roughly around 70% response rate. This is local health departments, and 60% of local health departments reported completing a community health assessment in the past 5 years. 51% had participated in a community health improvement planning process in the past 5 years. 31% of local health departments had developed comprehensive agency-wide strategic plans, and then 20% of local health departments had completed all three of these prerequisites for accreditation within the past 5 years. Next question is related to who it is that's responsible to assess community health. Is it healthcare providers, politicians, public health workers? As mentioned in the answer to the last question, it depends. It depends on the community and what the issue is. In some places, the public health system itself is responsible for conducting community health assessments. Either they are required to do so or they do so on a voluntary basis. In some places, there are nonprofit hospitals that also have an obligation to conduct community health assessments. So it varies, and in some places there may be more than one entity that's responsible for the assessments. So how frequently are the community health assessments conducted, and should there be a limit to the interval between community health assessments? The Affordable Care Act mandates that community health assessments be done every 3 years. Most of the states and counties that are required to do the community health assessments do so usually on a 3 to roughly 5 year cycle, so they have to be repeated that frequently. The argument could be made that if you are doing community health assessments, that they should be done moderately frequently, say no less frequently than every 5 years, in order to provide ongoing information for planning and program implementation within the community, to monitor the effects of the previous assessments, etc. How long does it take to do a community health assessment? Well, it takes a long time. The MAP timeline, MAP, if you'll recall, is one of the community health assessment and planning tools. It has a timeline of 18 or more months. It's considerably longer than just a basic community health assessment or a community health profile. The parts of the MAP process that take the longest are the community assessments themselves and what's called the action cycle, where the actions are implemented that were developed as a result of the planning process. There are needs in these assessments and improvement plans. You have to have a balance between process and product. There's got to be enough time to get people committed to the process, to provide their input. but you do want to have a product coming out in a reasonable period of time. So there is a tension between those two. If the process does take too long, one can lose momentum, and in future modules we will talk some about ways to keep up momentum and also to keep the community engaged. Here, for example, is a timeline for the map process. This process is roughly, as you can see from the top up here, this shows an 18-month timeline. The assessments here, which are this block, take 6 months according to this particular process on average. This shows the later part of the assessments. The action cycle down here is shown as taking 3 months, but in fact it continues on after this process, depending on what kind of actions are being implemented. So again, the assessments and the action cycle are the portions of the map process that take the longest. And that would probably hold for most other kinds of community health improvement planning and implementation processes. So, is there an optimal size, community size for community health assessment? Is there a minimum size? Well, if communities get too large, then people who are involved in the assessments or who are using the assessments may say that, well, that assessment doesn't really apply to our particular community or neighborhood. You're talking about a whole city. So there is some argument to be made for keeping the size of the community smaller rather than larger. However, one runs into problems with gathering data about the community if the community size is too small. So again, there's a tension here between having a community that is a good size so that people can identify with it and identify problems well and get people engaged in both looking at problems and trying to work on them, and communities that are too small that for which there is not sufficient data available. So another question was, is there a collaboration between communities or between states in order to reduce duplication? Well, in some states where there's statewide requirement for doing community health assessments, there often is a coordinated program. North Carolina is a good example of this, where there's a state program responsible for overseeing community health assessments within the state. They work on a more standardized approach to doing the assessments. The assessments are all turned into the state office. Some funds are even made available by the state office to fund implementation projects related to the assessments. Certainly, groups could get together, communities could get together and combine their efforts and resources in doing assessments, or at least developing tools together to do that. And some of these have been done to reduce duplication and extra effort. I see that I skipped over the question here about the relationship of the community health assessments to the FAB accreditation process. And let me just say a word about that. As was mentioned previously, community health assessments are in fact a prerequisite for even commencing or beginning the Public Health Accreditation Board accreditation process. So yes, there is a definite relationships, and they are a prerequisite.